What's up, y'all? Welcome back to From the Ground Up. I am so excited to jump in to today's topic. Before we dive right in, I did want to just let everyone know I'm really excited. I'm going to be hosting a free virtual live foot and pelvic floor workshop for pelvic floor therapists and coaches. It's going to be on September 23rd. Be sure to sign up for that in the show notes if you're interested. I would love to have you all there live. This past spring, whenever I hosted this workshop for the first time, I had over 600 people sign up and I got such great feedback. So I'm running it again, September 23rd. Be sure to sign up and you can find that link in the show notes, y'all. Today, though, what I really want to focus on is the fact that what our patients believe and what they say about their symptoms, their pain, whatever it may be, is going to significantly influence their outcomes. And as clinicians, as pelvic floor therapists, coaches, it is our job to uncover and help them kind of reshape or reframe those beliefs that they have about their chronic pain, chronic symptoms, whatever it is that they're seeing you for that's holding them back. I want to tell you guys a story. I used to say, I have a bad back. I just have a bad back. My back just goes out and that's just how it is. I just have a bad back. When I was in college, I played volleyball and I actually ended up quitting the team after a couple seasons due to this bad back of mine. And that's kind of when it all started. I don't know kind of what happened. I don't know how I injured it, if I injured it, when I injured it. All I know is that after a couple seasons of playing collegiate volleyball, I was starting to experience these bouts of back spasms and right-sided kind of pelvis and glute pain. And it was debilitating. It would happen. I remember there's one particular practice that kind of lives in my memory for whatever reason. I don't know why this one, but where, we were having our normal practice and my back started to spaz up again. And, I'm like, here we go again. It's my bad back. And it was spazzing and I had to step out of the practice and I had the athletic trainers come over and, they were doing their thing. They're stretching my hamstrings and we eventually made our way down to the athletic training room and we put on some stim and heat and ice and heat and ice and heat and ice. And, my normal things that I would do with my trainers to manage kind of this back flare that I would consistently have every month or something like that. There was a bout where it was happening more often than that, but we had kind of gotten it to a point where it was really only happening like monthly-ish. And so this went on for a couple seasons of college volleyball. And the story I was telling myself was, I just have a bad back, right? And I remember I grew up, my dad, quote, has a bad back. That is still the story he tells himself. And I remember seeing his kind of back flare-ups and hearing about it and hearing his language about, I just have a bad back. My back goes out. It gives out. It, whatever the language was. And now this is happening to me, a 20-year-old collegiate athlete, right? And that's just like wild to me. But the story I told myself was, well, I just have a bad back and this is just what happens and I just have to live with it, I guess, right? And so that was kind of the narrative that continued, and I continued with that narrative in the cycle of my back going out, my trainers giving me the stretches and the stim and the ice and the heat treatment and all of the things, and we would just cycle through like that. Until eventually it got so bad and the flares that were happening were progressively kind of getting worse and worse and more pain. And so I eventually, after 2 seasons, quit. I quit volleyball. And the reason behind it was, well, if I'm only halfway through my college volleyball career and my bad back is inhibiting me so much, missing out on so many practices in the grand scheme of things and even some games and things like that, it's just not worth it to keep going and further harm my back and further experience these things. So I'm just going to stop playing volleyball. I'm going to stop exercising, near as much. And I'm going to stop doing the things that were causing these back flares. And that didn't change until I actually got an internship at a PT clinic in college, because I was, now pursuing going to PT school and you have to get the hours and everything. And so I had just started my internship, and the PT that was there in the clinic, he kind of looked at me and he was like, "Does your back bother you?" And, I was just like, "Well, yeah, I have a bad back." Right. And he was like, "Huh." And so he did just like a mini assessment. Again, I'm like working there. I'm not a patient. I'm just an intern. He did a mini assessment and kind of gave me some exercises and things. And he was like, "Well, if you just do these exercises, it's going to manage your bad back, basically." And sure enough, I did the exercise he told me, and I kind of didn't really have, I mean, it really spread out my bad back flares quite a bit. Like, I think it was probably only happening a few times a year. And then that's kind of how it went through the rest of my time. Fast forward to like now, right? I'm 30 something years old. I think I'm 33. I'm like, I don't even know how old I am. I'm 30 something years old. And that was kind of how the trajectory throughout PT school, throughout becoming a mom, throughout joining the workforce, starting a business, it just kind of, I use those few exercises to manage my bad back. And it might flare a couple times a year, right? But I still carried with me that story of I have a bad back. And if I do the wrong thing, or if I go too hard, if I go play some pickup volleyball games or something and I go too hard, it might throw my back out again, or whatever the case may be. So I still carried that story with me, even though I had these exercises that seemed to kind of manage it and keep it at bay for the most part. Now, as I've had more and more experience treating pelvic health patients and learning more about chronic pain and chronic symptoms and how my patients' own beliefs truly shape their reality, honestly, and they impact their ability to heal and they impact their outcomes in therapy. In experiencing all of that with my pelvic health patients, I have been able to kind of slowly make various changes to the own narrative in my own head about my own body, my own thoughts and beliefs about my back. And I actually saw a great PT here local to me over the past couple years, probably, to really get to the root of why does my back tend to flare up whenever I'm doing things. Like, I remember one time a couple Christmases ago, I was on the floor wrapping presents and it put me out for 2 weeks after that. And I was just like, well, I just have a bad back. Right. So I sought out this other PT here in the Metroplex who I know, I love, and I trust. And he kind of helped me see, what if you don't have a bad back? What if you just haven't quite figured out maybe this movement pattern or this habit that you have? Or maybe there's other factors like stress, nutrition, things like that that are contributing to some of these flares. But maybe what if you don't actually have a bad back? And so he was kind of the first one to introduce me to that idea that what if I don't have a bad back? What if this just is something that has happened to me? And recently, so actually last week, I was in a workout, doing my own workout here at home. And I don't know what I did, but I felt my right low back just kind of start to spaz and talk to me. And for the first time, I didn't panic. I wasn't like, oh my gosh, it's happening again, my bad back, right? I just kind of was able to be curious, and I was able to kind of ask questions to myself of, what am I feeling? What does this mean about how I can continue my workout? What if I modify this movement this way? And instead of having these negative beliefs of, oh, so frustrating, my bad back, it's back again, I'm going to be out for 2 weeks again, I was able to just kind of be neutral and just kind of name what I was feeling and be curious about it and just play with movement throughout the rest of my workout. And I did end up modifying some stuff because, again, like, I would try a move and I would realize, well, that's hurting, right? And so what if I can modify it this way? What if I do it this way, right? So just kind of this neutrality, this curiosity, and I was able to kind of get through most of my workout with some modifications, right? And then that happened on, one day, and took some Advil that day because it was hurting pretty bad and I was kind of limping around. Took some Advil. My chiropractor was actually able to work me in that afternoon, and I saw her. She adjusted my pelvis. And then I went home and I got a good night of sleep in my bed and woke up the next day and honestly could say it was improved. I was like, oh, I can walk without limping, and I don't feel guarded, bending over to pick things up off the floor or whatever it is. And that had never happened. It had never gotten better that quickly. And then over the next few days, I just kind of got better and better each day. And then eventually, probably 5 days in, it was gone. And I was like, oh, well, I'm pleasantly surprised. And I tell you this story about my history of my quote, bad back, and then this most recent flare, this most recent bout of pain, because the only thing that changed is my beliefs about my back and how like the words I said to myself when I started to feel pain, and how I approached it more with curiosity and, more neutrality rather than automatic negativity. So ridiculous. Your back is so bad. You're only 33 years old. Why did this happen to you? Blah, 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 blah. And all of those thoughts that used to come up, right? And my recovery was so much quicker, and that's the only thing I changed. And I just find that so interesting because our patients do this too. They say things like, I can't lift heavier because I have prolapse, or whatever the activity is. I can't chase my kid around because I'm going to leak, or I have a tight pelvic floor. That's just how I am. And so they have these stories that they've been telling themselves about their own body, about their own symptoms for however long. And the stories that they're telling themselves have been shaped by the words that they've heard from others, especially medical providers, right? The words that they've been hearing from their medical providers about their symptoms become the story that they tell themselves and the story that they believe about themselves. Back in my college days, I ended up, at one point seeing, I think, like an orthopedic back doctor or something like that. And, he pointed out, you got some arthritis here at L4 and 5, and, probably some disc herniation stuff going on here. And, you're going to feel these things, and it's just going to be something you deal with. And, and those words stuck with me. And in my head, I'm like, I'm just going to deal with low back pain for the rest of my life. And I'm in my 20s. Like, that's ridiculous, y'all. So the words that our patients are hearing from us as their trusted medical providers about their symptoms and their bodies become the story they tell and the story they believe about themselves and about their ability to heal and about their future and about how they can overcome these things. And I have a patient right now that I want to share her story because it really comes down to what she believed about herself and about her body's abilities and about her pain when she first came in. And then now how she's doing so well, what's shifted is her beliefs about her body, right? So I've been seeing her probably, 6 or 8 months. So she came in for her first visit. And she was coming in originally for chronic back pain, mid back pain, low back pain, and then also stress incontinence, specifically when she would have like a respiratory virus, so sneezing, coughing. And then also she mentioned, if she was going to do a jumping workout or every now and then, if she's running and chasing a kid or something like that, she would notice some leaking. And so her main thing though, she came to me because of the leaking, because she had done some research on her own about, I'm having pelvic floor symptoms with all this chronic back pain. Could it be my pelvic floor? So when she got to me though, her main goal was to hopefully overcome her back pain. And if her leaking got better, great. And so I began to ask her questions, and as her story unfolded, it became evident to me that she had these beliefs about her body, about what it couldn't do, about what that meant for her current pain and future pain. And just some history on her was she has scoliosis. And so as a kid, as like a preteen, she had the Harrington rods put through her spine. And she was told from then on, she's now, in her mid-30s, she was told from then on, you can't rotate because you have rods in your spine. And that was what she remembered was, she didn't quite know why she couldn't rotate, but she remembered being told by her doctors and her surgeon and everything, you can't rotate. And so she has, for 20 years, spent her life tense and avoiding rotation and even avoiding bending because, she thought, well, if I can't rotate, surely I can't bend over either. I have rods through my spine and my spine can't bend. So she had spent her life so tense and avoiding all of these normal functional movement patterns, telling herself, I'll hurt my back if I do this. Or, God forbid, I'll break a rod out of its spot in my spine. And that was the story she was telling herself. And so fast forward to now, she's having all this low back pain. She's having all this mid back pain. She's leaking. She's unable to run around and chase her kids without pain. She got teary when she said, I can't even help my husband load the car when we're, going on a trip because it would involve twisting and bending and lifting and it would hurt my back. And it's, kind of ironic because all of these beliefs about her body, if I do this, then it will hurt my back. Well, she's living with this chronic debilitating back pain, right? And so slowly but surely over my time working with her, I was able to kind of help dismantle her beliefs about her own body and about fear of movement and about, true reality and true limitations of movement based on her medical history versus maybe what she had been believing all of these years and what she had understood about her limitations. And so I really worked on that with her and kind of dismantling this fear around this, if I do this, then this will happen. And that's really what our job is as PTs, OTs, coaches, right? It's our job to help our patients and our clients reframe with curiosity, with that neutrality, reframe their beliefs about their body instead of having these negative beliefs about their body and about their symptoms and about their movement patterns and about their ability and their ability to heal and move and all of those things. And if that's our job, if it's our job to help them kind of reframe their belief system around their bodies and symptoms and abilities, we have to ask the right questions, right? To get those answers and to understand what they believe. And if we don't ask, we don't know what they believe about their bodies, right? But the right questions matter. We can't just say, what are you afraid of? I guess you can, but you might get some interesting answers. I'm afraid to bend and twist, So the right questions matter to get the truth out of what our patients believe. And sometimes they don't even know what they believe, right? We have to help them discover that by staying curious and by asking, open-ended questions. And, just some examples that come to my mind is what do you believe will happen if you rotate your spine? And then hear them out and hear them. Well, if I rotate my spine, maybe my rod is going to crack out of my spine or something, whatever it is, right? Hear them out about what their biggest fear is. If this happens, then this will happen. When you feel this symptom, what is the story you're telling yourself about it? Okay. When you experience a flare, what is your first thought? I'm thinking back to me in the gym and this more recent flare. I'm in the old days, my first thought would have been, oh, here it goes again, your bad back. That sucks. That's so dumb that this happens to you. You're only 33. But what in reality, my thought was, that's interesting. What am I feeling? And I just kind of checked in with my body. So when you experience a flare, what is your first thought? And that'll give you some information about their beliefs. What would it be like if you didn't have this pain and symptom, right? This one tells you kind of in a reverse way what they believe this symptom or symptoms are preventing them from doing or experiencing, right? So what would your life be like if you didn't have this pain and symptom? And that their answer there gives you a lot of information about their beliefs that, well, with this pain and symptom, that means I can't do those things. And all of this is happening in the initial evaluation, absolutely. But really, we're doing this throughout our time with them and throughout our care. And we're never not being curious and never not asking these questions and being a detective and helping them to kind of make these connections on their own, because that's what true kind of holistic care looks like. It's not just I checked off these questions at the initial eval and then from here I'm going to stop asking questions. We got to integrate it throughout their care with us. I've been seeing this patient that I told you guys about for, over half a year now. And I'm still, every time I see her, I'm asking her different questions about her beliefs about her abilities now, right? She's in Pilates nowadays and she's not leaking anymore. And, she knows that she can bend and lift and twist and pick up a laundry basket or chase her kid out in the front yard or whatever. And her beliefs now are, well, let me try it and see how it feels and, gather data rather than label it with this negative if-then statement. And we have to help them reframe those beliefs once we figure out what they are, right? And so if an old belief is, if I rotate my spine, I will hurt my back and be in pain for days. Okay, that was my patient's belief. Maybe the reframe is, My spine has been sensitive to rotation in the past. I wonder what my body's trying to tell me when that happens, right? And I wonder how I can better support it this time. It's that curiosity, right? Or maybe there's an old belief of, I just have a tight pelvic floor. That's just how I am, and I always will. Maybe the reframe is, my pelvic floor is holding tension. I wonder what's contributing to that and how I can shift it. Okay, curiosity. Maybe it's my back flared up after sleeping weird because I have a bad back, right? That could be what a thought I used to have, is if I, wasn't in my own bed at home, I was surefire going to wake up and feel the next day because I have a bad back. Okay. And so maybe the reframe is, I wonder what other factors might have contributed to this flare up. And I wonder what I can do to support movement and healing today. Okay. Maybe it's, I can't lift weights because I have prolapse, and surely my bladder will fall out if I lift heavier. And maybe the reframe is, what strategies can I use to improve my pelvic floor function today and for the longer term so I can keep moving and I can keep exercising? It's this shift from like negative belief just automatically to neutrality, curiosity, and honestly, like optimism, like let's have a little hope. Let's believe in our body's ability to heal a little bit. But it really is these kind of simple shifts in mindset that we can help coach our patients on that'll create safety in their nervous systems, which could be the thing to stop the chronic pain cycle and reroute it altogether, right? What we know about chronic pain is it's this cycle that happens, and how you get them out of it is you have to chop the cycle somewhere and get them out of the circle. And if you are truly, truly in this field of pelvic health, if you're truly in this to change the game, and I know that you are, because that's why you're here listening to my podcast, we have to take this angle with our patients. We can't just be biomechanics and manual therapists. Okay. It has to go beyond all of that, all of the fancy treatments that are flashy, and they can be helpful, right? But all the fancy treatments aren't going to get our patients results if they believe they're not going to heal, or if they believe they can't move because it's going to end in pain. Okay. It's more than just load, as much as I love a good load to the pelvic floor. It's more than, well, just load them up. Their pelvic floor will respond because we're going to make it automatic. That is true. Let's do load, people. And it's got to go deeper than that. What our patients believe about their symptoms, about their bodies, about their ability to heal is going to have a massive impact on their clinical outcomes. Okay. And it's our job as their PT, as their OT, as their coach to treat the full person in front of us and help them understand that and reframe that so they can build resilience. And that truly is how we change the game as pelvic health professionals. So, hope this was eye-opening to you guys. I hope this gave you kind of a reframe of your own thoughts as well. And, some things to think about and go take back to your patients today, tomorrow, whenever you're in the clinic next, and help them uncover what those negative beliefs are and help them reframe it. So that way you can really get them out of that cycle, that negative belief cycle and chronic pain cycle or chronic symptom cycle, whatever it is. This probably is the thing that is missing for a lot of our chronic pain patients, is their beliefs about their own bodies. I also want to remind you guys that the fall cohort of my signature No Kegels course is starting up in October. So be sure you're on my email list. You can find that link in my bio so you don't miss it. And then also, like I said at the beginning, I'm hosting a free foot and pelvic floor workshop on September 23rd. This is for PTs, OTs, coaches, anyone really that works with people with pelvises, so like literally all of us, who are interested in the biomechanics of it all, the whole kinetic chain. And finally, if I could ask, if you enjoyed this episode, I would absolutely love it if you would share it with another coach, another clinician that would find it helpful in their practice. It always makes my day when I see you guys share this to your stories. When you tag me, those are the best notifications I get for Instagram. So I would love it if you would share. And I hope you guys have a great rest of your day, and I will see you next week.